Hi, if the video and the audio is clear means just comment. Please comment if the video and audio is clear means. I think the video is clear. Also the audio. Hi, if the video is clear or then the audio is clear means please comment. Please. Vinish and Virendra, please comment. Clear, clear. Okay, okay. Thank you. We'll wait 2 minutes. 2 minutes for the other students to join. We'll wait 2 minutes for the other students to join. This YouTube video class will be available in our website also. After completing this class, it will be available. It will be available in the your website also. Good evening to all. Priyanka, Sumitra, Virendra, Suraj, Biswas, Anju, Vinish, Virendra, also Barsabas, good evening. So it's a free class, it's a free live class, and here we will discuss regarding fundamental of nursing. So fundamental of nursing MCQ we will discuss, along with there will be some discussion of core points, and you will be getting this type of free live class till Aims exam. Okay, so you can join our WhatsApp group. Also, you can WhatsApp me on my WhatsApp number 73561828880. So this is the WhatsApp number. So in that WhatsApp number also you can message me, so that I will be adding you to a WhatsApp group. From there you will get the updates regarding free live class. Okay. Okay, so we will start our Aims Norcet free live class, and this class will be available till Aims exam. Okay, 2 minutes, 2 minutes. Okay, we are going to start our Aims Norcet free live class, and this class will be available till Aims exam. Here we will discuss MCQ plus core points discussion. Okay, core points discussion. So before starting this live class, I will tell you some learning strategies for you. Learning strategies in the sense, I know that you people are working somewhere in some hospitals or maybe in school or college of nursing, and you are not getting enough time, and the exam is very near, the Aims exam is very near. So you don't have enough time to cover all the topics, to study all the contents. You don't have enough time. But within a limited time, you can study well, you can attend the exam in a proper manner, and you can score or crack a good rank in the upcoming exams. So within a time limit, or we don't have enough time, but within that time limit also, if you study regularly, then you can easily crack the exam. You can have a good rank in the exam. So that type of learning strategies I'm telling. most of you are, I hope most of you are working in some hospital, and due to this COVID and all, you are having a very busy schedule. So after duty you are not getting enough time. So if you can follow this learning strategy, definitely you can, within this time limit, you can study well and you can crack the exam. First one is, you must have some basic and important concept. Okay, so you have to study the basic and important concept first. Basic and important concept. Those people who already in our online coaching, they are already getting this basic and important concept as a video class, as a study materials. You are already getting that thing. It is available in our website, the basic and important concept. So first what you have to do, you have to study the basic and important concept. So our students already, I think they started or they are continuing the study. Those people who are not in our online coaching, those people who are watching in from the YouTube, you have to start the basic and important concept study. Means we don't have enough time to study all the things in a detailed manner, but you must have some concept, you must have some idea regarding any topic. If I tell you chest drainage system, you should have some idea. Okay, that is called a basic and basic concept, you should know. So on that basic concept you can build more and more. Okay, next, once you study the basic and important concept, like if you are studying fundamental of nursing, you will study the important topics and basics from fundamental of nursing. Then what you will do, you will you will practice online exams. Okay, you will practice online exams. You can practice. So fundamental of nursing, you will practice the online exams. Then you will go to the next topic, I mean next subject, which is medical surgical. So nervous system you will take, you will practice online, like that. Okay, so you should have basic, then online exam practice. Next is coming the core point and MCQ discussion. So this strategy also will help you. So you already have that basic idea, you are already practiced a lot of questions. Now we will discuss some advanced or core points plus some MCQ discussion. So this will also help you. This will also help you to have more knowledge, more idea regarding that particular concept or topic. Then last but the important one, that is model exam practice. Practice as much as you can. Okay, so when you are practicing more and more questions, you will get more and more topics or points, I mean core points, or lot of points you will get. So all together definitely will help you for a better RAM. So in model exam practice, one more thing is important. The thing is that you have to practice the time management. Time management is very important. So in all the live classes, we will be giving you some tips and techniques for attending these exams. Hope you will be able to crack the exam very easily. Okay. दीपक शाह आस्क्ड बुक्स मिल सकता है क्या? देखो बुक्स नहीं, ये हमारा स्टडी मटेरियल है, वो हमारा वेबसाइट में अवेलेबल है. वेबसाइट में स्टडी मटेरियल है, यू कैन डाउनलोड इट. ओके, so I told you the learning strategy. 4 things you have to understand. Basic concept you have to study, online exam you have to practice, then core point discussion, model exam practice. Okay, the next class also I will be telling you some tips there. So today's tips, I will tell you one tips for you. Okay, today's tips. Today one student told me that she messaged me. She told me that I'm not getting enough time to study, because after completing my duty, after my hospital duty, when I'm coming to my home or hostel, I'm very tired. So I'm not able to plan my study. I'm not able to spend some time for study. So the tip is that I know that you people will not get enough time for study. Suppose if your duty is finishing at 5 o'clock, then you are going to your home. You will be tired. So that day you may have a lot of work in home or in hostel or in your room. You may have a lot of works. You have to cook, you have to wash clothes, lot of things. So to find 2 hour or 3 hour in one day, it's difficult. In off days it is not a problem, but other days it may be a problem for you. So what you have to do, you have to divide your study time. Divide your study time means when you go to your room, open the books or website. If you are using our online coaching, you can use our website, or you can if you are using books, lot of books are available for competitive exam. If you are using that books, open that books, okay, open that book in a table or on your bed. Then what you have to do, read or study 15 minutes, read 15 minutes, close it, go to your work. You may have work for cooking or cleaning, lot of things. Then again come back, read 50 minutes again. 50 minutes reading, it's not a big deal. 50 minutes you will read properly. 50 minutes, close it, go for your dinner or whatever it is. Again 50 minutes, again 50 minutes. So like that, 15 15 15 15. Okay, so easily you can, easily you can find out 1 hour on your schedule, on your busy schedule day. Also you can find 1 hour, very easy. Okay, 1 hour is easily you can find one day. So initially you have to find 1 hour, later you have to increase the timing. Okay, and the other days, like your off days, holidays, you have to find more and more time, more and more hours for studying. Okay, so this is the tip for today. Now we will start MCQ discussion and core point discussion. This is the first question. Before that, I have to tell you, today we are going to discuss some MCQs with some theory part. So now itself you will study, now itself. Okay, you don't need to read or study later. Now itself you will study. We will study together we will study. So this 1 hour or 2 hour means it is not like you are watching some video, you are answering some question. No, you are studying now itself. Okay, with me you will study. And if possible, if you are in your room, if you are watching me from your room, means keep a notebook with you. In that, make some notes, not all the contents which you see in the screen, not all the contents. Important points I will tell you, that point only you have to note, and you will study that point today itself, now itself. And that note you have to review before your exam. If Aims before you, if you are going for Aims Norcet exam, means one day before you have to take that note. Within 5 minutes or 10 minutes you can review that thing. So that important points only I will tell you, which all are the important points that you have to note. Hope you have some idea about these kind of questions, these kind of topics. I think you already started your preparation. Lot of our students already started these preparations. For the other students, please start your preparation. And those people who would like to join our coaching, you can WhatsApp me. Okay, so you can start the preparation. Okay, so first question is respirations that are abnormally shallow. Respirations that are abnormally shallow for 2-3 breaths followed by irregular period of apnea. Okay, what will be the answer? Respirations that are abnormally shallow for 2-3 breaths followed by irregular period of apnea. So the important points, when you see this type of question, you have to check. Okay, they told you 2-3 breaths, abnormally shallow 2-3 breaths followed by irregular period of apnea. So they have given you Kussmaul respiration, Tachypnea, BIOT'S respiration, hyperventilation. The options are Kussmaul respiration, Tachypnea, BIOT'S respiration, and hyperventilation. What will be the answer? Now please don't hesitate to put your answer. No problem. If your answer is wrong also, no problem, because we are learning together. Okay, Sushri is telling it's BIOT'S. Aradhana is telling, Sharon, Ipsida, all are telling BIOT'S respiration. Let's see. Yes, the answer is BIOT'S respiration. So before going to the next question, we will discuss about these type of points. So we will learn today itself together. We will learn BIOT'S respirations. Okay. So first one, we will think about Kussmaul breathing or Kussmaul respiration. So what is Kussmaul respiration? Kussmaul respiration means rapid, gasping and very deep type of labored breathing. So Kussmaul respiration means there will not be any apnea, no apnea. Here apnea is absent. In Kussmaul respiration, apnea is absent. Here we can say the apnea. There will be apnea. That is also irregular period of apnea. Okay. So in Kussmaul breathing, there is no apnea. It's a rapid. It's like, if you can see me, it's like rapid and very deep, not shallow, very deep type of labored breathing called Kussmaul breathing. I think you know this. What is Kussmaul breathing? Okay. Next point. Kussmaul breathing is also called as air hunger. Okay. Sometime in question they will tell you. Okay. Air hunger. Okay, air hunger breathing, otherwise known as Kussmaul breathing. Okay, air hunger breathing, otherwise known as Kussmaul breathing. Next, it is associated with severe metabolic acidosis and diabetes ketoacidosis. You all know these things, right? You all know these things. It is associated with metabolic acidosis, particularly diabetes ketoacidosis. So, important points. Diabetes ketoacidosis is associated with Kussmaul breathing, diabetes ketoacidosis. Next important thing, Kussmaul sign. Kussmaul sign. What is Kussmaul sign? Increase in JVP, jugular venous pressure. Okay. Increase in JVP during inspiration. Increase in JVP during inspiration. It is called Kussmaul sign. This thing you can note, because I know you know about the Kussmaul breathing and all. So one extra point I am giving you, Kussmaul sign. What is Kussmaul sign? It is not related to, okay, this is Kussmaul sign. Kussmaul sign means increase in JVP during inspiration. So in exam there will be lot of signs you can see in exam. Lot of when you study you will be facing lot of signs. Kussmaul signs, Chadwick signs, lot of signs. So Kussmaul sign means increase in JVP during inspiration. This point, please note it. Okay. And you know why they have given this name Kussmaul? Why the Kussmaul? The name Kussmaul is coming because the doctor who find this type of breathing pattern, his name is Kussmaul. Okay. That is why the name came Kussmaul breathing. Okay. So you learned about Kussmaul breathing. So 3-4 points I will tell you. We will learn together. Kussmaul breathing means rapid gasping type, very deep, like this. Okay. It will increase. That is called Kussmaul breathing. Very labored type of breathing. Kussmaul breathing. And other name of Kussmaul breathing is air hunger. And why the name came? Because Kussmaul breathing, the breathing pattern, it's found by the doctor. His name was Kussmaul. Then Kussmaul always related to diabetes ketoacidosis. Then another thing, Kussmaul signs. Kussmaul sign means increase in JVP, means jugular venous pressure during inspiration. That is called Kussmaul sign. So if there is a problem in Kussmaul signs, extra point I am telling you, it means that there is a problem in the right side of the heart. Okay, if there is an increase in JVP during inspiration, is called Kussmaul signs. It indicates that there is a problem in the right side heart dysfunction or right side heart problem. Okay. Okay. Next we will see tachypnea. You know tachypnea. What is tachypnea? Increased rate of breathing. Right? Tachypnea means increased rate of breathing. So increased rate of breathing means normally above 20 breaths. Above 20 breaths we will tell tachypnea. Normal adults respiratory rate is between 12 to 20. So if the respiratory rate is more than 20 means we will call it as tachypnea. So if you know all these points, easily you can eliminate each and every options. So here, if you come to here, okay, you know that Kussmaul respiration will not be the answer because there is no apnea in Kussmaul respiration. Tachypnea means it's a it's not like a labored breathing or something. Tachypnea means the breathing will be quick and more than 20. Quick and more than 20. Okay, so you can eliminate 2 points here. All right. Okay. Tachypnea is characterized by rapid and shallow breathing. Rapid and shallow breathing means not deep breathing. Rapid means suddenly, okay, quick, and shallow breathing. Okay, so these type of points is very important. Rapid, shallow breathing. So somebody is telling tachypnea means, we all tell that tachypnea means the number of the breath will be more than 20. Not only 20, there will the breathing type will be, see, in Kussmaul respiration it will be like deep breathing, but here in tachypnea the breathing will be rapid but shallow. Okay, you got my point. Tachypnea. Bradypnea, you know what is bradypnea? If the rate is below 12. Okay, bradypnea. Hyperventilation. So you may get confused. What is hyperventilation and what is tachypnea? All right. Tachypnea means, I told you that rapid but shallow breathing. Like, but hyperventilation means rapid and deep breathing. Rapid, also deep. Okay, deep breathing. Okay, this is different from Kussmaul respiration. Okay, Kussmaul respiration it will be like a labored breathing. Okay, hyperventilation, you got what is hyperventilation, you got what is tachypnea, you got what is bradypnea, you got what is Kussmaul respiration. Okay, all these points. I told you to note only one point, that is Kussmaul side. That you have to note in your book. Okay, next comes chain stocks breathing. Okay, chain stock breathing. It is not in that options, but I'm just telling you chain stock breathing. What is chain stock breathing? Okay, in chain stock breathing is otherwise called as periodic breathing. You can note that point. Chain stock breathing, otherwise called as periodic breathing. Because you know that name chain stock, but maybe sometime they will ask you what is the other name, or period. In the option it may be like a periodic breathing. So the other name of chain stock breathing is periodic breathing. And you know how the name came, chain stock breathing, the name came because the doctors who discovered this type of breathing pattern, or who noted this type of breathing pattern, their name was, one doctor name was starting with chain, the other doctor name was starting with stock. So chain stock, two doctors. That's why this name came, chain stocks breathing, otherwise called as periodic breathing. Okay, and here there will be tachypnea and its alternate periods. Okay, alternate periods. That's why periodic breathing. Like tachypnea, there will be tachypnea will be there. Then apnea. Apnea means absence of breathing, for temporary absence of breathing for some time. Okay, tachypnea, then apnea. Tachypnea, then apnea. So here in chain stock it will be tachypnea and apnea. Altered. Okay, it's regularly it will come. Tachypnea, apnea. But in BIOT'S respiration, it is the apnea will not be in a periodic manner. It will come. Irregular apnea will be there. It is not like a regular apnea is coming. Regular apnea will come in chain stock breathing. Tachypnea, breathing, stop, breathing, stop. But in BIOT'S respiration, there will be breathing and apnea will be there. Then we don't know what time, which regularly apnea will not come. Okay. So alternate periods of tachypnea, then apnea. It's called chain stock breathing. You got that point. Chain stock breathing, you got. And this is an important point. Chain stock breathing can be seen, classically seen in damage to pods. If the patient is having a damage to pods, like in brain or head injury, if there is a damage to pods, where your respiratory center are located. Where is the respiratory center is located? On pons. So if there is a damage to pons, you can see chain stalk breathing. So you can note chain stalk breathing can be seen in damage to pons. Okay, if there is a damage to pons, you can see chain stalk breathing. This point you can note it. Next, we will go to the BIOT'S breathing. So our answer was BIOT'S breathing. Okay, now we will discuss regarding BIOT'S breathing. Right. BIOT'S breathing, the other name of BIOT'S breathing is cluster breathing or ataxic breathing. Cluster breathing or ataxic breathing. Okay, BIOT'S breathing name. So we are learning together, right? BIOT'S breathing name is cluster breathing or ataxic breathing. We told what is chain stalk breathing. What is chain stalk breathing other name? If you can comment, chain stalk breathing other name. Can you comment? What is the other name of chain stalk breathing? What is the other name of chain stalk breathing? Just comment me. What is the other name of chain stalk breathing? Periodic breathing. Okay, yeah, periodic. Triptirega is saying, Siddharth is saying, Susri is saying, Ganguly is saying, periodic breathing. Okay, periodic breathing. So BIOT'S breathing other name is cluster breathing or ataxic breathing. Okay, so here the breathing will be like quick and shallow inspiration, quick, and followed by apnea, but it is not a regular apnea. It is irregular type of apnea. Sometimes regular, but normally irregular periods of apnea. But this is quick and shallow. In Kussmaul, it was deep, like deep, right? Deep. Then here and in chain stalk, I told you that there will be tachypnea and apnea, but it will be regular. But in BIOT'S breathing, it is not apnea will not be regular. It will be irregular. Mostly it will be irregular. That is BIOT'S breathing. Then, if there is any lesion to brainstem, so if there is a problem to brainstem, especially medulla, if there is a problem to brainstem, especially medulla, you can see BIOT'S breathing. Okay. So in I told you in chain stalk, if there is a problem to pons, damage to pons, there will be problem in chain stalk breathing, and in BIOT'S breathing, you can see brainstem problem. If there is a lesion or injury to brainstem, you can see BIOT'S breathing. It's a important point. Okay. So next question is the purpose of water seal chamber of a chest drainage system is to. The purpose of water seal chamber of a chest drainage system to. So in the beginning I told you that when you study the learning strategy, I told you that when I say chest drainage system, if you have studied the basic concept, so you have some idea. Okay, this is chest drainage. Okay, there are different type of bottles. Some idea may be coming to you, right? So if you have studied that thing, otherwise you will be blank. So you have to go and you have to study the basic first. Okay, don't worry, we will discuss the basic also here. So the purpose of water seal chamber of a chest drainage system is to, without giving option, if you can answer, if you can tell the points. Okay, in some questions it is like that. In some questions, without giving option, you will give the answer. It's called as easy type of questions. Okay, so anyway, we will use the techniques, easy techniques to answer. Okay, right. Okay, the first option is it will foster removal of chest secretion. It will foster the removal of chest secretion. So if you know the what is water seal chamber of a drainage system, then only you will be understand what is the removal of chest secretion, all those things. Otherwise, don't worry, we will learn together. Okay, we will learn together, because we don't have after duty you are attending the class, and we know that you don't have enough time to study again and again. Okay, again sit and open this open these videos and study. I know that it's very difficult, so we will study together itself. So foster removal of chest secretion, prevent the entrance of air into the pleural cavity. If you know the answer, you can comment now itself. Okay. Second option is prevent the entrance of air into the pleural cavity. Third one, it will facilitate emptying of bloody drainage from the chest. It will facilitate the emptying of bloody drainage from the chest. Then fourth one, decrease the danger of sudden change of pressure within the tube. Decrease the danger of sudden change of pressure within the tube. So what will be the use of water seal chamber? What will be the use of water seal chamber? If you know the answer, you can comment. Vinicius is telling gravity. Gravity is one of the principles. Okay, one of the principles in the using in the chest drainage system. Okay, Sherin Jacob is telling B. Sharon is telling B. Anju is telling B. Okay, so the answer is B, means prevent the entrance of air into the pleural cavity. So I know that many students, they don't have idea about what is water seal chamber in a chest drain system, all those things. So suddenly I will give a a few points or few ideas regarding chest drainage system. Okay, so you know what is chest drainage system. Chest drainage system we use to drain blood, air, or sometimes pus, all those things from the chest cavity. When there is this type of excess air, in pneumothorax, hemothorax. Okay, in all these conditions, what we will do, we have to remove this excess fluid or excess or air from the chest cavity. Why do we want to remove it? That is the first question. Why do we want to remove? So your chest cavity is having some excess air, like pneumothorax or hemothorax, or there is effusion or whatever it is. Why do you want to remove it? If you are not removing it, what will happen? The answer is that for a normal breathing, okay, you need a negative pressure inside your chest cavity compared to the atmospheric pressure. So outside atmospheric pressure must be positive pressure, then inside it should be negative pressure. Then only you can breathe, then only you can take oxygen into your lungs. Otherwise, what will happen if in your chest cavity the pressure is more positive pressure, because of this fluid, because of this air, your lungs cannot be expand properly. To have a proper breathing, to take oxygen from outside into your lungs, there must be some negative pressure inside your lungs. Okay, got this point? Okay, so to create this negative pressure, we are using this chest drainage system. So by using this chest drainage system means we will put some chest tube into the chest cavity. Okay, you can see here in this picture, you can hear they have put the chest tube into the thoracic cavity. Okay, then they are removing the excess. There is pus or blood, means they will remove that one, or if air means they will remove that thing. Okay, so normally this is an old type of or maybe you are using in your hospital also. If you are using this kind of chest drainage system, please comment. If you are using this type of chest drainage system, please comment. Okay, so it's a three-way bottle. Okay, three bottle. This is a three bottle drainage system. What is this? This is a three bottle. It's a three bottle drainage system. So here to the first bottle, okay, we have connected what we have connected, the chest drainage system or tube we have connected. So in this bottle we will collect that fluid, pus, blood, whatever it is coming, it will be connected, it will be collected. So this is the first bottle. In the first bottle we are going to collect this drainage, maybe blood, maybe pus. Okay, and the second bottle is called water seal bottle. Second bottle is called water seal bottle. And the third bottle is called it's a suction bottle. Third one, suction bottle. Sometimes you can see two bottle, maybe there will be only fluid collection bottle and water seal bottle, sometimes only fluid collection bottle. Okay, so the I will tell you the first bottle. What is the function of the first bottle? Simply it will collect the drainage. What is the third bottle? It's a suction bottle. There will be also water, but it is called as suction bottle because it work as a suction. Okay, there will be suction. You can see here it's connected to the suction. It is connected to the suction. So this suction bottle will help for more, more drainage. If you want to increase the drainage or the if you want to, so there will be automatically there will be some pressure will be there to remove the fluid. But if you connect it with the suction, more easily, like you can improve or increase the removal of secretion. For that you are using suction bottle. If you are not using suction bottle also, it will work. Okay, but suction bottle will help you to increase the the drainage, okay, collection or secretion. Okay, so second bottle, we were talking about second bottle. There is a second bottle. So in this second bottle, the air which is coming from the thoracic cavity, okay, from the pleural cavity, the air is coming here in this bottle, and from this bottle it will go to the water seal bottle. It will go to the water seal bottle. So you noticed here the tube is inside the water. The tube should be inside the water, so that what will happen, it will work as a water seal chamber, so that it will trap the air. It will trap the air entry into the chest. So no more air will, if it is not here, inside the water, means what will happen, air can go, depends upon the pressure, air can go here again to your chest cavity. But now it will not go to your chest cavity because it is water seal. This is water seal. Okay, it's a water seal. It's a water seal chamber, so air will not go. Okay, again simply I will tell you. Okay, if it is confusing for you, means just understand what is chest drainage system. And in chest drainage system there will be three bottle. Normally three bottle will be there. One bottle for the suction, one bottle for the collection of the fluid, and thus one bottle for the it is called as water seal bottle. Because of water seal bottle, no more air will go into, okay, air will come from the chest cavity. Air will come from the chest cavity to this bottle, but from here no more air will go into the chest cavity, because if air is going into the chest cavity, it's a problem. It will create more pressure and all, positive pressure and all. Okay, simple. So that is the use of water seal bottle. So always remember that in the water seal bottle, the tube will be below the water level, Okay, and you may be seeing this type of chest drainage system in your hospital. It's a new mode of chest drainage system, pleur evac. Okay, you may be seeing, maybe in image based question you can expect this type of picture. So it's a pleur evac, means it's a modern type of chest drainage system. Okay. Hope you are getting the. Okay. If you are getting the videos properly, please comment me. Please comment me if you are getting the videos properly. Okay, Anju is telling you are getting properly. Okay, right, good, thank you. Okay. Next, some points regarding chest drainage system. I will tell you some points that you have to note it. Exam points. Okay. So you got some idea regarding what is chest drainage system. That is concept only. You got some concept only, and more concepts will be there. Some points I will tell you. Some points I will tell you that you have to understand. Okay. Size of the chest tube. Normally for adult male, the chest tube size is 28 to 32. 28 to 32. That you have to by heart. Okay, we will be discussing lot of chest tube size, not only chest tube, ET tube, NG tube, lot of tubes. Okay, so the size is important. So for the adult, the size is 28 to 32, adult male. For child, it is 18. 18. So what is the uh, unit? It's a French. Okay, so 28 to 32 French for the adult, and child it's 18. For newborn it's 12 to 14. For newborn it is 12 to 14. Okay, 12 to 14. Then this thing I already told you. Normally, chest drainage tube drainage system. I told you there will be three bottle, two bottle, one bottle, different type of. Okay, so normally chest tube drainage system they are having three bottle or three collection chamber. But one is drainage collection chamber, which I told you the first one in which you are collecting all the drainage. I mean the pus or blood, all those things. Second, I told you water seal chamber. Third, I told you suction control chamber. Now the exam point is you can see in water seal chamber, in drainage collection chamber nothing, we will collect the drainage, that's all. In the water seal chamber you can, I told you there will be some water. Okay, there will be some water level or water will be there, and normally that water will be having some oscillating movement of water. It's an important point. Oscillating means, hope you can see my hand, how the hand is moving. It's an oscillating movement. Okay, like oscillating movement, not bubbling or anything, oscillating movement. So there will be oscillating movement of water when patient inhale and exhale. When patient inhale and exhale, there will be oscillating movement of water. It's a normal finding. So question may ask you, as a nurse, if you are if you as a nurse you find that there is a oscillating movement of water in the water seal chamber. Remember, in water seal chamber oscillating movement, what will be your action? So it's a normal finding, nothing to worry. But if there is a continuous bubbling or excessive bubbling or continuous bubbling in water seal chamber, I'm talking about only water seal chamber now. In water seal chamber, if excessive bubbling or continuous bubbling, it means that there is a air leakage. It indicates air leakage. It's a abnormal finding. Okay, what is it? What does it indicate? It indicate abnormal finding like air leakage. In intermittent bubbling also you can see. You can see intermittent bubbling. Intermittent bubbling you can see, especially in pneumothorax. Intermittent bubbling, especially in pneumothorax, you can see in water seal chamber. It's a normal expected finding in pneumothorax. If in pneumothorax, it's a normal finding. So oscillating movement, no problem, but excessive bubbling or continuous bubbling is problem. It shows excessive air leakage. But if and you can see also intermittent bubbling, especially in pneumothorax, that is also expected thing. Okay, expected normal finding. But if there is no oscillating or fluctuating movement, if there is no oscillating or fluctuating movement, it means that that tube is kinked or obstructed, or sometimes your lung has re-expanded. Okay, so two chances is there. Sometimes you cannot see any more. If there is no oscillating or fluctuating movement, means it is obstructed or the lung has re-expanded. So I told you in chest drainage system there will be 3 bottle. One bottle drainage bottle, leave it. Second bottle water seal bottle. In that water bottle, sometimes excessive bubbling will be there. It's a problem, or continuous bubbling, it's a problem. And the oscillating movement is normal. If there is no oscillating movement, then you have to check whether the tube is kinked or obstructed, or sometimes the lung has expanded, or sometimes the lung has re-expanded, came to the normal level. Okay, intermittent bubbling, it's expected one in pneumothorax. Okay. Next, we'll check the suction control chamber. In suction control chamber, there will be gentle bubbling in suction control chamber. So because why the gentle bubbling means it shows that the suction is working. Simple. So gentle bubbling in suction control chamber, it means it is working. The suction is working. Simple. Okay. Next, nursing responsibilities. This is also very important. Nursing responsibilities. So you got what is chest drainage system. You got different bottles. You got the bubblings in different bottles. Now the nursing responsibility. So in the beginning I told you, for cracking the central government exam, because it's multiple choice question, right? So for cracking that thing, you don't need a more ideas or more knowledge regarding nursing. Sorry, this example, this chest drainage system or anything. You should have some idea. Then these important points you should know. Nursing responsibility. If the drainage amount is more than 70 to 100 ml per hour, okay. If the drainage amount is more than 70 to 100 ml per hour, what you will do? You will inform the physician. First point. Or if the color is bright red in the sense, bright red means fresh bleeding is going to happen there, or fresh bleeding means there is bleeding is going on. So you have to inform the physician. 70 to 100 ml per hour, not the point. 70 to 100 ml per hour, or the color is bright red, means inform the physician. Suppose if the chest tube is pulled out of the chest. Okay, so in this suppose if the chest tube pulled out of the chest cavity, chest tube pulled out of from the chest wall, from here, okay, not here, from here, what you will do? Okay, the question is, if the chest tube is pulled out from the chest cavity. So as a nurse responsibility, you have to apply an occlusive sterile dressing if the chest tube pulled out of the chest. If the drainage system breaks or the tube disconnected from the drainage system side. Okay, now before I told you if the chest drainage system disconnected from the chest wall. If it is disconnected from the bottle side, what you will do? You will insert the tube. Sorry, you will insert the tube into a bottle of sterile water. You will insert the tube into a sterile water bottle. Okay, so you have to clearly you have to read the question from where this drainage system disconnected or the tube disconnected, from the chest wall or from the bottle. Okay, then while removing the chest tube from the patient, okay, now everything is clear, patient is okay, we are going to remove or we want to change the chest tube. What you will do, you will ask the patient to take deep breath and hold it. Deep breath and hold it. Okay, while removing the chest tube from the patient, you have to tell the patient to take deep breath and hold it. Okay, one more thing I will tell you. Okay, whether we can clamp the chest tube, normally we don't clamp the chest tube. You can clamp the chest tube while transferring the patient or transporting the patient. Okay, that time you can clamp, but you should have a proper policy or order from the doctor. Without a doctor order or without you have to follow the hospital policy to clamp the chest tube. Okay, normally we will tell do not clamp the chest tube. Okay, and before, as Vinish told, gravity. Okay, gravity is one of the principle of chest drainage system, gravity. So it means that you always have to keep the chest drainage bottle below the chest level, So due to the gravity, because of the gravity, the drainage will be coming to your bottle. Okay, so one thing is gravity is the one principle. Second principle is suction. We are using suction, and third one is this water seal. Okay, so these are the three principles we are using in the chest drainage system: gravity, suction, water seal. Anything. Okay, in the options there may be gravity or suction. Okay, they can put anything. Okay. Which of the following techniques are examples of non-therapeutic communication? So there are two types of communication: therapeutic and non-therapeutic. Therapeutic means those communication, those things which will foster or enhance or help for the treatment. That is therapeutic communication. So as a nurse, we have to use therapeutic communication to communicate with the patient. So which of the following techniques are examples of non-therapeutic communication? Giving advice, focusing, restating, paraphrasing. What will be the answer? Example for non-therapeutic, not for therapeutic. Example for non-therapeutic. See, lot of times people will make easy questions wrong. Okay, it may be an easy question, but because student is not or the candidate is not reading that properly, they are making mistakes. So whenever you read the question, check they told like which of the following is not a, or which of the following is a, or if there is sometime like except. Okay, like which of the following except. So these kind of words you have to read properly. Sometimes if you miss that word, you will make an easy question wrong. So if you make an easy question wrong, means your rank will go very low. Okay, if you make a difficult question wrong, it's not a problem. But easy question, all people are going to make it correct, and you make it wrong. So don't do that, because in any exams, there will be 30 to 40% easy questions. If you can answer this easy question, then your selection will be very easy. Then you have to score, uh, you know, no need to do that much effort to get marks. Like you are, if you can score this easy questions, then definitely it will give you confidence, and you can expect selection. So do not make any mistakes in easy questions. Which of the following techniques are examples of non-therapeutic communication? Okay, all are telling A. Sharon, Lipsida, Sandeepa, all are telling A. So the answer is A, giving advice. Okay, as a nurse, do not give any advice. We are not, we can give knowledge sharing and all, but don't give any advice. You have to do like this, you have to, it's not, it's called advice, right? So you can give like health education, you can give information, decision always from patient side. So giving advice is a non-therapeutic communication. Focusing, restating, paraphrasing. Focusing means that when one patient is telling his problems or complaints or whatever it is, so when you are focusing on that, what the patient is telling, it means that the patient will get more and more interest to talk with you, to communicate with you. So focusing. Restating means asking again. Okay, tell me what you told before, tell me. So it means that you are showing some interest. Paraphrasing, you are, you know, in some question you have to change the way you are asking. So paraphrasing. So all those things are therapeutic communication. Giving advice is not a therapeutic communication. I will give you some examples for non-therapeutic communication. No need to note it. Simply by reading, you will understand it's not a good communication technique. Right, like providing false reassurance, giving false reassurance. It's a non-therapeutic. Then stereotypical comments. What is stereotypical comments? Stereotypical comments means whenever the patient is telling something, you are giving always the same answer. Oh, okay, yes. It means that patient feel that, no, this man is not interested in my conversation, in my problems. So giving stereotypical means again and again giving the same type of comments. Stereotypical comments. It's not a good communication. Giving advice or approval, it's not a good communication. Asking the patient why, always asking the patient why, it's not a good communication. Challenging the client, do not challenge the client. Can you do like this, can you do like that? Okay, so all these things are non-therapeutic communication. Then changing the subject. Sometimes patient may be talking with you his problems or complaints, then you suddenly change the topics or subjects. That is also not a good communication. It's a non-therapeutic communication. Examples I was telling. Okay, no need to note it. By reading itself, you will get an understand. Okay, this is therapeutic or non-therapeutic. Type of consent in case of medical emergency, where doctors start emergency treatment to patients who cannot give informed consent and for whom no immediate family can be reached to make such decisions. So when you read the question, you feel that's a bit long, but see, that's why I told you, when you practice model exams, you will get a, skill like reading the question easily or fastly and understand that easily. Okay, you will get that type of practice. Otherwise, what will happen? You will study something and you are going, you don't have any practice. Then you are sitting on a real exam. Suddenly, you are seeing all these things on your screen, computer screen. Suddenly, you will get confused. Okay, so don't do like that. So practice with timing. Okay, with timing. Okay, you have to, with time management, you have to do that. Okay. Type of consent in case of medical emergency, where doctors start emergency treatment. So in case of medical emergency, there would be some type of consent you have to give. So in, okay, one medical emergency came, then their doctors start emergency treatment. Sometime maybe some operation, sometimes some other treatment. and this patient, he cannot give informed consent. Okay doctor, I'm ready for this treatment. Okay doctor, I'm ready. Maybe the patient may be unconscious or whatever it is, and for whom no immediate family can be reached. There is no one is there, no immediate family, nobody is there reached to make such a decisions. So this type of consent called what? Implied, absent, process, written, informed. Implied, absent, process, written, informed. What will be the answer? Implied, absent, process, written, informed. Okay, Ipsida is telling it's we already discussed this question, I think, in our daily question session in the WhatsApp which we are sending. Okay, so the answer is implied. So we will discuss regarding in this concept. So today we are discussing only fundamental of nursing. In the next class also we will discuss fundamental of nursing. So within 2 or 3 live session we can finish the fundamental of nursing important points or important topics. Okay, hope my voice is clear for you. Okay, type of consent. Implied or tacit consent. Okay, I will tell you some consents. Implied or tacit consent, informed consent, expressed consent, advanced consent, surrogate consent, and proxy consent. Okay. So what is implied or tacit consent? Implied or tacit consent means when you are going to hospital, maybe somebody is bringing you to the hospital, maybe you are unconscious or whatever it is, or you are voluntarily you are going to a hospital. So it means that you are going to the hospital for treatment, right? For treatment. So for that, no need to get consent or something. You came to an emergency department because you have some emergency. That time you will not ask the nurse or the doctor will not ask you. Okay, if the situation is like that, okay, like I will do this type of surgery, I will do this. No, you will not ask, or it will be, the situation may be like that because you came to the hospital because you need some treatment. So you already agreed for that treatment. Okay, so that type of consent, it is already there by default. There is some consent. When you go to the hospital, then again doctor will not ask. Okay, it's like example, you are having some respiratory depression. Doctor will not ask you if that can I give you a bag wall mask, or can I give you CPR. Doctor will not ask. This is called implied or tacit consent. But in some situation, like informed consent, some situation like in one OPD, or if the doctor, if the patient is admitted in a ward, or maybe the doctor will tell to the patient or to the family, that patient will like the doctor will give some information. Okay, we are going to do this surgery, or we are going to do this type of treatment. We will give these medicines. So all this information we will pass to the patient before starting the treatment. Not in all the situation, but in some situation I'm telling. You have seen, like doctor will tell, okay, your problem is that we diagnosed this thing and we want to start this treatment. We will give you these medicines, we will give you this kind of treatment, all those things. We give this information. So this is called informed consent. Okay, informed consent. You will inform the patient about the things which you are going to do, right? And in some situation, expressed consent. Expressed consent means in some situations you have to get consent, expressed consent from the patient or family, like in written or oral. Written or oral. Example, in operation, before going to operation, we will get some written consent from the patient. So in some, when you are going to do some operation, all those things, you want to get some consent, expressed consent from the patient. That is called expressed consent, written or oral. Okay, whatever it is. Then advanced consent. Advanced consent means before death. Before death, sometimes some patient before death they will give some consent for doing the things like okay, I'm ready to give my after the surgery or whatever it is, I'm going ready to give my eye or all those things. Before death, patient may give some consent, advanced consent they will give. Next, surrogate consent. Surrogate consent means family. If the patient is 12 years and below, they cannot make all this kind of consent. So, then the family will give the consent. Or if the patient is not mentally stable, if patient is unconscious, then the family, immediate family, or the other people who are near, they will give consent. That is called surrogate consent. Family is giving surrogate consent. Then proxy consent means proxy consent. The patient is unconscious and no immediate family or anyone is available there. So those people who are around them, maybe police, maybe some other people, they may give some consent for doing this type of maybe patient is unconscious, doing this emergency treatment or something. That is called a proxy consent. Okay, so important thing is surrogate, expressed, implied. All these consent are important. Okay, so in this question, see, it is in a medical emergency. Doctor start emergency. Doctor is going to do start emergency treatment, and nobody is there. There is no family near to him. If family is there, means we can take the consent from the family, and no family is there. So the doctor himself starting the treatment, because it comes under implied, because it is by default there is a consent. Doctor no need to ask any consent to anyone. It's implied or tacit. The other name is tacit. Okay. An example of conceptual framework is framework. Susri is asking informed and expressed consent. Okay, Susri Sonali is asking what is the difference between informed and expressed consent. Informed means simply doctor is will inform. Okay, we are going to do this treatment. We are we will give you this kind of medicines, all those things. And sometimes a patient will ask, what is the other treatment I can take, and what will be the progress of the my disease, survival rate of my disease, and whether I'll be get cured, or is it expensive. Lot of questions the patient will ask. So the doctor will gives lot of information. Okay, we are going. The doctor will give the entire plan what he is going to do with the patient. So this is informed. Okay, he is informed consent. Expressed means patient will for some procedures, like they are going to do some procedures. The doctor is going to do some emergency surgery or treatment or procedure, operation, whatever. So if it is a somewhat complicated things, means example for surgeries, we will get consent, written consent we will take. That is expressed. In expressed, I told you there is oral and written. This is a written. Oral example, oral consent or expressed consent, but orally, like we are going to do a physical examination. The doctor or nurse is going to do a physical examination. So before doing physical examination, the nurse will tell, okay, I am going to do the physical examination. Can I do? Ask the permission. So the patient will not write and give. Patient will tell you, yes, doctor, you can. Okay. This is oral consent. Okay. Sandeep is telling proxy consent, right? Proxy consent means there is no immediate families available there. Immediate family is not available. So the patient is in a dangerous situation. Patient is unconscious. Sometimes police, not the immediate family, maybe police or any maybe the people who are around brought him to the hospital. So these people will give some consent. That is called proxy consent. Okay. Can an informed, Susri is asking, can an informed consent be in written form? Informed consent means, see, depends upon the condition we will take the consent. Okay, when we will take informed consent means for this kind of procedure we will tell the patient, okay, okay, I am going to start these medicines, I'm going to start these medicines, that's all. Informed consent. To start a medicine, or to start a treatment, simple treatment and all, doctor no need to get any written or oral or all those things. Doctor just inform him, okay, okay, that's all. But for some type of like more critical things, means critical procedure means we have to get the signature or consent from the patient. Okay, so it is depends upon the situation we will take the consent. An example of conceptual framework: patient feedback, nursing process, progress note, progressive patient care, progress note and progressive patient care. Umakant, I think I already told expressed consent. Expressed consent means the patient is expressing. So maybe orally he will tell, or by written he will give consent. That is expressed consent. Okay, what will be the answer? An example of conceptual framework. Telling B. Sharon is telling B. Okay, the answer is B, nursing process. It's a simple question. No, these kind of questions are very simple. I told you in any exam there will be easy questions. There will be easy questions. So when you attend this kind of questions, do not take more time and all. Simply, okay, an example for conceptual framework, patient feedback, no. Nursing process, I think yes. Progress note, no. Progressive patient care, no. Okay, the answer is B. Finish. You will go to the next point, because this is a simple question, simple options. So this kind of question you have to finish easily. For that we are telling practice model exams more and more. Okay, if you practice more and more model exams, if you have basic concept ideas, definitely it is very easy to score or crack exams. Okay, if Aims exam, if you can get 60-65%, not percentile, percent, easily you can get selection. Okay, so don't think that I want to get 100%, I want to get 80%, I have to study all the contents. Don't think that like that. Just use our strategy which I told you in the early or beginning of the class. Follow that, definitely you can do. From today onwards, study daily, regularly, properly. Okay, so all got the answer, that is nursing process. This thing you can have an idea, conceptual framework, maybe like a definition. They will give you the definition, and they may ask you which of the following or this definition is belongs to, like that. So what is a conceptual framework? Means a written or visual presentation, maybe a written or visual, like diagram, all those things. Visual presentation explain in graphically or narrative, maybe like some diagram they will put, or they will write narratively, like what we are going to do. Suppose if you are going to do a research, the method how you are going to do that research, a diagrammatic representation, or they will write. Or if you are going to do some project, or if you are going to do suppose in nursing care, you are going to do a nursing care for a patient. So there should be a visual representation or written presentation or explanation should be there what you are going to do. So like in nursing process, you know, there will be assessment, diagnosis, planning, implementation, intervention, evaluation, all those things. So there is step by step we are going. So it's a framework. So nursing process is a framework of a complete project or complete work what we are going to do. It is you know, it is available in nursing research, nursing care, everywhere. Okay, that is called conceptual framework. all all the measurable and observable information about the client on his or her state of health. Okay, when you read this question, you will think, what is this? All the measurable and observable information. Just go to the options. Okay, so the question is measurable and observable information about the client. Okay, so I have given you four data: biographic, primary, objective, and subjective data. So the data should be measurable, it should be measurable, and it should be observable. Okay, it should be measurable and it should be observable. So what is that? Measurable and observable. What is the answer? Data which is measurable and observable. Okay, telling objective data. Sherin Jacob is telling objective data. Ganguly is telling objective data. Simple. It's the answer is objective data, because subjective data, you know that it is not measurable. Subjective data means what the patient feels. Okay, what the patient feel. That is subjective data. Maybe she will tell, I'm feeling cold. You cannot measure that thing. Okay, you cannot. Sometimes patient tell, I feel chest tightness. You cannot observe that thing. So it is not the subjective data. Objective data means you can observe all those things. Biographic data means you are taking, like, from where you are coming, all those things. It is not measurable. Okay, all the things. Then primary data means those data you are collecting by yourself. Data collecting by yourself. Directly you are going and collecting data. That is primary data. Okay. Then human and animal waste, microbial and biological and soiled waste are disposed in. Human waste, animal waste, soiled waste, biological waste, microbial waste, all are disposed in. Or are this kind of questions are, easy questions. Simply you can, no need to spend more time and all. If you know, you can easily, you can answer, no need to use your brain and all. Okay, simply you can answer. Blue bag, red bag, yellow bag, black bag. Yellow bag. If she is telling yellow bag, if you people are feeling that, okay, it's a usable, or if this class is useful for you, then you can share this link, of this class link, or our um, WhatsApp number or WhatsApp group. I already posted in the comment section. WhatsApp group, you can share to your friends for attending the free live class. Okay, so as I told you, we are learning together. Okay, we don't have enough time, okay, to study again the same things. Now we are learning these things together. Okay, so make some short notes. Close your, after this class, close your books, because you are studying now itself. Okay, then before exam, open these things and you can refresh these type of points. Vinish Varg is telling not clear. You mean the class is not clear? Is the class is clear? Any problem in the video or audio? Okay. So the answer is C. It's yellow bag. Okay. So you can see the updated biomedical waste management. Updated one, biomedical waste management. This is the updated one. They updated on 10th June 2020. It's not important. Okay. So all the general waste, if you are working in a hospital, definitely you know that all the general waste. Sandeep is telling it's clear. Okay, okay, thank you. All the general waste, we will put all the general waste. We will put in where, in the black bin. Okay, but contaminated COVID-19 things, we will not put in the black bag. Okay, contaminated COVID-19 things, we will not put in the black bag, but other general waste we will put in the black bin. And yellow, in yellow what we will put? Blood bag, soiled dressing, anatomical waste, cytotoxic waste, and general waste contaminated with COVID-19 like PPA cover, okay, and gown, all those things. So where you will put PPE cover, which is used, PPE cover, then general waste contaminated with the COVID-19 patient. General waste, normally general waste we will put in black bag, black bin, but if it is contaminated with the COVID-19 means we will put it in yellow bag. This is the updated one. And PPA cover all where we will dispose, will dispose in yellow. Blood bag, yellow bag. Soil dressing, yellow bag. Then anatomical waste, cytotoxic waste. Anatomical and cytotoxic waste we'll put in yellow bag. And red. In red bin you will put all infected plastic. All infected plastics. Okay, rubber tube, all those things, plastics, everything you will put it in red bag. Then glassware, ampule, vials, broken glassware, ampule, vial, all those things you will put it in where you will put in the blue, and needles, blades, syringe, all those things in the white. Okay, so needles white, broken glassware, all those things, ampule, vial, all those things blue. Okay, because we don't have time to study again and again. Okay, you will study now itself. Keep it in your mind. Keep it in your mind. Okay, blue means you put glassware, ampules. Yellow I already told you, and plastic in red. Then what you will do? This thing also very important, because normally all the people will study from up to this only. Okay, I will put the blood bag in yellow bin. That's all. After that they are not studying. So question they will ask you, what you will do this yellow bag, yellow bin. So the wastes in the yellow bin, what you will do? Don't go this and all. You just study incineration, deep burial. Incineration, deep burial, yellow. At least study this one. Yellow bag, incineration and deep burial. Yellow bag things, yellow bin waste, you will go for incineration and deep burial. Okay, and all the red, blue, all those things, red, blue, all those things, you will do autoclaving, microwaving, and you will do recycling. Okay, recycling and all. Red, blue, and all you will go for recycling. Just study like this. Red, blue, you will do recycling. Only yellow things you will go for incineration, deep burial. Yellow, incineration, deep burial, because we don't want to use it again. So you will incinerate it and deep burial. Both things we will use. Yellow bag, treatment or disposal. And these easy questions only. These symbols. Okay. Okay. If you see this symbol, it's called biohazard. This is cytotoxic. This symbol for cytotoxic. This for biohazard. Then intermittent positive pressure breathing is contraindicated. Intermittent positive pressure breathing is contraindicated in comatose, pulmonary edema, asthma, tracheoesophageal fistula. And sometimes, see, sometimes when you study or sometimes when you attend model exams and all, you will see a lot of questions in which you don't have any idea, and maybe the concept will be very tough concept. And if you go and if you are going to study that concept, if it is taking more and more time and it is confusing, means don't do that, because you don't have time. If you have enough time, it's no problem. Otherwise, don't go and study that very difficult concept if you cannot understand it. Is like in ventilator, and this one intermittent positive pressure breathing. Okay, there is negative pressure breathing, positive pressure breathing, intermittent. Okay, lot of other ventilator mode, lot of things. It's very if you feel it is very complicated for you, means just understand that. Just okay, this question. If this question asks, I will answer. That's all. Stop it. Sometimes you have to use your common sense. Okay, if they ask me these questions, okay, that's all. I will answer this one because I don't have time for, you think like that. I don't have time for going very deep on these topics to study. Oh, no. So we will save time for studying other things. Intermittent positive pressure breathing. It is contraindicated in, what will be the answer? Tracheoesophageal fistula. Okay. Actually, you have to give this intermittent positive pressure breathing those patients who can develop atelectasis, okay, and patient who cannot breathe deeply without assistance. So they need assistance only. They need assistance. If you are not providing that assistance, what will happen? There will be atelectasis. What is atelectasis? Collapsing of the lung. Okay, but you see, if you see the other conditions, pulmonary edema, asthma, comatose patient, in these conditions you need to give continuous the support, continuous support, not only assistance. Maybe in comatose patient you have to give more and more. Okay, so intermittent positive pressure breathing is contraindicated in which mostly contraindicated in tracheal fistula and hemoptysis. Tracheal fistula and hemoptysis, it is contraindicated, and absolute contraindication is untreated tension pneumothorax. Untreated tension pneumothorax is an absolute contraindication because you cannot give more and more positive pressure. There is already pneumothorax, so you cannot give more and more positive pressure to the patient. So treated pneumothorax, tracheal fistula, hemoptysis, it's a absolute contraindications. That's all. Okay, don't go further because it may take time for you. Okay, next thing is that regarding your model exams practicing. When you practice model exams, when you attend first time, okay, normally people what they are doing, they will attend one time. They will check the answer, they will finish. Okay, I attended this model exams. Then they will check another questions. Even you are studying from books also, you are doing the same thing. You will read question, you will check the answer, finish, you will close the book. But the exam is coming after 2 or 3 months. That time it is not necessary that you will remember these questions and all. So what you have to do, if you are attending 100 questions, do it 2 or 3 times so that you will not remember. Okay, just do the same exam. You will attend exam one time, you will get 30 or 40 marks. You will attend again, you will get 50 or 60. You will attend again, you can check the answer and you attend again. Then do it till you become expert in that questions, till you get 100% mark. So that what will happen, same question you are watching 2 or 3 times. When you watch through 2 or 3 times, you will not forget that questions. If the exam is coming after 5 months or 4 months also, you will not forget that questions. Like that you have to do it. People are not doing like that. If you failed or if you cannot crack the central government exam, means the entire responsibility or the entire mistake is on you. It's because of you only you are not getting selected. You don't need to find the reasons. Okay, I didn't get the good book, my duty was busy, my teacher was not good. No, it's because of you didn't get selection. If you decided and if you are working, definitely easily you can get the selection. Okay, hyperbaric oxygen therapy is used to treat which of the following patients? Hyperbaric oxygen therapy is used to treat which of the following patients? Organophosphate poisoning, mercury poisoning, carbon monoxide poisoning, narcotic poisoning. Sorry, I put the answer. Sorry. Hyperbaric oxygen therapy. So these 2 hours we are learning together. Today you people find 2 hours to study. So improve timings or increase your timings. If it is today 2 hours, then if possible, study 1 hour more later. So like that. Central government, you can put the answer in between. Okay, you can put the answer in between. I'm just telling you. See, central government job, it's a journey, it is not like that you will come and see this class one day and you will go and attend. No, you will not get it, you will not get the selection unless you are a genius in the sense. No, there will be some genius without studying also they can get the exam. Otherwise, continuously if you are studying, definitely it is possible. But the thing is that you are not studying, it's a journey. Now you came to attend the class. When you attend the class, you got, okay, these type of questions are coming, this is the way I have to prepare for the exams. Then you will practice, you will attend the real exams, so you will get more and more information. You will be more and more close to the job. Then you will attend a real exam, then you will get more experience. So again you will get a lot of ideas. Okay, this is the mistake I have done. Again you will practice, study, you will go and attend. So simply within 2 or 3 time of attempt, not all the people, if you are doing properly, otherwise it will take time, but this job is possible for you. If you are ready to work, if you are ready to do hard work for sometime the entire life you can enjoy with a good job, good secured job. Otherwise you have to be, in a private hospitals, not all the private hospitals, but I'm sure that in most of the hospitals the duties are very hectic, very busy schedule, and you are not getting enough, leaves. You are not getting a good salary. Lot of problems are there. You have to face these problems till you are alive, till you work in that hospital, or till you are in this field. You have to face all these problems. But if you can do something for you now, if you can study something properly, not study, okay, simply I'm going to attend the exam, I will open the books, read something from the here and here. Lot of people, what they will do when they think about central government, they will go and buy some books, that's all, and keep it in their room, that's all. A lot of people told me, sir, I bought this book. If you, it doesn't mean that you will get selection. Yeah, one book is not enough. Okay, it's the preparation is different. When you do all those things, definitely later you will get an idea. Okay, this is the way. Okay, this is the way I have to study. You will be telling me, okay, this is the way to prepare, or you will be giving advice to other. See, this is the way you have to prepare. This is the technique. Not like we studied for university exam. Not like we studied for BSc nursing or GNM. It's different. Okay, okay. Because if I teach you all the time, no, you will get bored. That's why I told you. Hyperbaric oxygen therapy used to treat which of the following patients? People told C, answer C. Somebody is Ankur Pandit. Who is he? I don't know. He is commenting to. Maybe you know. You maybe you know Anju, but it's not good to know. That's why. Sorry. In the comment section, I saw somebody is mentioning others, so it's not good. That's why. Sorry. Maybe you are friends. because when we put public, no, when we put these things on public, normally I'm not doing live class on a public, like we will give link in private section, but sometimes other people will come and they will start to comment all those things, so that's why I just removed that message. Okay, no problem. Okay, this is a hyperbaric oxygen therapy. So in image section you can see hyperbaric oxygen therapy. In image questions also you can see hyperbaric oxygen therapy. Hyper means what? Hyper means increased. Baric means pressure. So it means that you are giving more pressure, pressurized oxygen. Okay. So we will put the patient in a closed cap like this. See, closed cap like this. Okay. Then you will give more pressurized oxygen. Okay, more pressure oxygen. See, sometimes if it is not only used, it is not only used in this carbon monoxide poisoning. You can use it in diabetic wound. Diabetic wound. In diabetic wound, what you will do? You will put this patient. If suppose the wound is on leg, means we will put the patient leg in a closed cabin. In that you will give this type of oxygen, high pressure oxygen, because it will create the oxygen will be more absorption, all those things will be there, so it will help to in diabetic wound care, it will help for a proper healing and all. Okay, proper healing and all. So this is hyperbaric oxygen therapy. You may be heard iron lung. Iron lung, that is different. Iron lung is different. Iron lung means you will put the entire, it's a old treatment therapy. You will put the entire patient in one iron cage, iron cabin, because if you take the patient outside he cannot breathe like that. This is not iron lung or something. Hyperbaric oxygen therapy. In hyperbaric oxygen therapy you can give more and more saturated or pressure oxygen to the patient, so this oxygen will can go into the patient blood more easily. It is not only used in carbon monoxide poisoning, I told you in diabetic wound care also you are using. And 2 point I have to add, who invented or who discovered oxygen? Joseph Priestley. Simple question may ask. Discovered oxygen. Joseph Priestley. Mainly for this kind of question, exam like CHO, all these questions, all those exams they will ask you. Like PSC exam and all they will ask you. OSSC exam and all these type of questions they will ask you. Joseph Priestley discovered oxygen, but the name oxygen was coined by Anthony Lavoisier. So Joseph Priestley who discovered oxygen, but the name oxygen was coined by Anthony Lavoisier. Anthony Lavoisier, Joseph Priestley. Joseph Priestley may be familiar for you because he discovered oxygen. Anthony Lavoisier also familiar for you, but he for other discoveries. But he also he was the person who coined the name oxygen. When pressure applied to a swollen area, the indentation persists after the release of the pressure is called as. When pressure, you are going to apply pressure to a swollen area, so there is an edema and you are going to apply pressure, the indentation means that when you apply the pressure, no, that area will be, you can see area will be pressed, or indentation, it's called indentation. Like if this is the swollen area, suppose this is your leg, I mean foot, and when you press here you can see a indentation. Like after releasing your hand also, if the pressure, if you can see the indentation persists there, it is called as what? Simple question only. Refractory edema, weeping edema, dependent edema, pitting edema. Pitting edema. So you know that the answer is pitting edema, right? Pitting edema. But I just want to explain the other edemas also, because it will help you for the exams. So this is pitting edema. Pitting edema means you have swollen area. This is a swollen area, and if you are pressing here, means that area will be, there will be indentation. Indentation means that area will be like you can see that area. It's pitting edema. Okay, so normally classification of edema can be can classify into generalized and Localized. This is one type of classification I am telling. This is one type of classification. Generalized and localized. The generalized edema we can call anasarca. Anasarca means generalized. Anasarca means generalized edema. We can call other name is dropsy. Dropsy. Now we are not using this word. This is an old word. Or dropsy. Dropsy. Okay. So generalized means if the entire body is having that edema means generalized edema. Localized means if it is only like your hand or a limb or any particular part. Let's localize it. This is one kind of classification. No need to study, simple thing only, just understand. Okay. The other classification, pitting, edema, another classification is pitting. Pitting means what? When you press, if that area is indentation, it's called as indentation. Okay. It's called pitting edema. Non-pitting means if you press, it's like, see, pitting edema, otherwise called as cutaneous edema. This is another point, cutaneous edema. Sometimes they will not tell you pitting edema, they will tell you cutaneous edema. Pitting edema means cutaneous edema. So if the indentation persists, means it's pitting edema. Where you can see in pregnancy, this is very example. Pitting edema can be seen in pregnancy, heart failure, congestive heart failure like varicose vein. Then if there is a water retention. So pregnancy important. Pregnancy, heart failure, varicose vein, pitting edema. Non-pitting edema means when you press, after that if you release, if there is no indentation, the place is becoming normal. When you press, there will be some type of indentation. When you release, it is coming to the normal. So this is you can see in mixed edema, lipedema, lymphedema. Okay, at least study mixed edema. In mixed edema, you can see non-pitting edema. In mixed edema, you can see non-pitting edema. Refractory edema. What is refractory edema? So in some cases, like in some edema, normally if there is edema, you will use, you will tell don't take sodium and you will give diuretics. So after this after giving diuretics, after restricting the sodium also, if the edema is not responding, or the edema is there, is persistent, and if the edema is not going, it is not responding, means it's called a refractory edema. So any edema which is not responding to diuretic use or sodium restriction. Normally what we will tell, okay, we will do some treatment, all those things, like we will give diuretics, we will give sodium. Still if there is edema, means called refractory edema. What is weeping edema? Weeping edema means swelling. Okay. When the swelling or edema became so severe that edema became so severe and fluid start to leak from the edema. You can see from the skin the fluid is coming outside. That is a weeping. Weeping means crying. Okay. So weeping edema. Okay. So you got what is a weeping edema. Dependent edema means because of gravity. When you stand for a long time, fluid or blood will pool in the lower parts of the body, especially in the feet. So that type of edema called a dependent edema. You see, what is the dependent edema? If somebody asks you, you will tell dependent means because of the gravity. If I am standing for a long time, if the edema is happening, dependent edema. Weeping means if the water is coming from the edema site or skin. That is a weeping. Refractory means if the edema is not responding to treatment. Refractory. The pitting, non-pitting, Okay. Okay. Next, what should be the size of the endotracheal tube for a newborn weighing It's 2000. Okay. It's 2000. It's not 3. Okay. It's 2 kg to 3 kg. So the question is that what should be the size of an endotracheal tube for a newborn? For a newborn, what is the size? I told you have to by heart the size of ET tube. You have to by heart the size of chest tube, all those things. So what should be the size? 3, 2.5, 4, or 3.5 for newborn. The question is for a newborn. For newborn, the simple question, this kind of question is called as easy question without confusion. If you know answer, you can give answer and you can save the time. Okay. So all are telling D. I think all are telling D. The answer is D. 3.5 is the size of the ET tube for a newborn. So for adult it's 8. Adult male means it 8 mm. Adult female 7 mm. For pediatric, for newborn it's 3.5. For newborn, I told you before, 3.5 for newborn. Okay. For pediatric means those more than 1 year and below 8 year. 1 year, between 1 and 8. Pediatric, what is the tube size? So I can give you one formula that is age. At least study this one. Cuffed ETT. Normally they will ask you this one. Cuffed ETT. Age by 4 plus 3.5. Age by 4 plus 3.5 for pediatric. The formula for finding the tube size of pediatric. Pediatric means from 1 to 8 year. For newborn and all, we can use 3.5. But pediatric from 1 to 8, what we will do? We will use a formula. Formula is age by 4 plus 3.5. At least study this one. Age by 4 plus 3.5. You can note it, otherwise you will forget. Note it. Pediatric endotracheal tube size formula. Age by 4 plus 3.5. Okay. No, not me. No, not me. This kind of reaction. Okay, no, not me. This reaction of the patient is seen in which stage of death? Okay, which stage of death? So in especially terminal patients, stage of death means terminal patient. You know different stages of death, right? With different stages of death. So you can see this stage of death in terminal patient only, like who are waiting for the death, those who are having terminal illness. In the other type of like accident death, there was an accident, there will not be these kind of stages like acceptance, bargaining, denial, anger, nothing. Means suddenly you are dying. Okay, but in terminal patients you can see there are different stages of death is there. Like what are the stages of death? Denial, anger, bargaining, depression, acceptance. This is called DABDA. This is called stages of death or stages of grief or loss. This is by Kubler-Ross. This theory is by Kubler-Ross. This theory is by Kubler-Ross. Stages of death: denial, D for denial, A for anger, B for bargaining, D for depression, acceptance. All these classes are available in our website. So, hope you have seen that class. You studied these things. So these are basic things only. Okay. So no, not me reaction. Like patient is telling, no, not me. Okay. This is this type of reaction can seen in which stages of death? In acceptance stage, bargaining stage, denial stage, or anger stage. I told you there are different stages of death. So patient is telling, no, not me. This reaction, you can see a reaction of patient can seen in which stages? In acceptance? No, definitely no, in acceptance, because the patient will not tell, no, not me, because he is accepting. Bargaining means what? Bargaining means the patient is asking, no, please, no, oh God, please help me, doctor, please, what is the other options for treatment? I will go here, I will do that, somehow, please help me. This is bargaining. Anger means what? Anger means you feel, no? Okay. Yeah, Susri Sonali is telling stages of grief. So denial, the answer telling, Ganguly is telling answer denial. So the answer is denial. Denial means you are denying. Doctor is telling that See, you are having a terminal illness, you are having cancer stage 3, or you it's a terminal illness, you may die, or it's very difficult. So that then the patient is telling, deny. This is the first stage, deny. No, no, not me. You have mistaken, doctor, not me. I am not supposed to die now. Not me. No, you are wrong. You are wrong, doctor. You are wrong. No, not me. So this kind of reaction you can see in denial stage. So I told you regarding damp diet. Okay. What is the ideal length of insertion of a rectal suppository in an adult? What is the ideal length of insertion of a rectal suppository in an adult? Just by heart it. Okay. If you know the answer, just write. Otherwise, 4 inches. So you are going to insert a rectal suppository for an adult. So normally we are not checking, how many inches we will put. It's not possible also. But ideal length, or there should be some measurement for each and everything, right? We are not measuring anything when we are introducing or inserting a rectal suppository. We are just simply inserting, right? Okay. 4 inches, 2 inches, 10 inches, 9 inches. Sharon is telling B. 2 inches will be very, very less, I think. 9 and 10 will be more. 9 and 10 will be more. So the answer is 4 inches. Just by heart it, 4 inches. Okay. So if this question is came to you and you don't know the answer, Okay. These kind of questions, if it is coming to you, you don't know the answer. So but you have to answer, like at least you have, but I'm telling you have to answer. So what you will do? So you don't have any idea, but still when you check, you can see that 9 and 10, 9 and 10 means very near. 9 and 10 very near number, and these numbers, see, this number you see, uh, it's a big number, no? 9 inches, 10 inches means when you put suppository, 9 inches and 10 inches means very far. So this will not be. Sure, this will not be. So I'm eliminating. My mind is saying, I am not having an idea, but my mind says eliminate it, because 9, 10 nearby only, and it's very, very big number. 9 inches, 10 inches means it's very difficult. It's not possible. Then I have confusion in this A or B. A or B. So whatever your mind is saying in that time, when you are attending the exam, in that time, whatever your mind is saying, give the answer. If A means A, B means B, no problem. Okay, because if you do like this, the chance for getting this thing correct means 50%. 50-50 chance is there. Otherwise, there is no chance. Or here, more chance is there. You can do all those things. Tips and tricks I will tell you later in the later classes. Okay, so okay, next class I will be updating you in WhatsApp when will be the next class. Please attend the next class and please start to study every day. Then don't worry. So a lot of people are in tension. Do not be that much in a tensed mood or something. Relax. It's a challenge. Study every day. Study every day properly. It's not like you will open the I want to study today means you will open the fundamental of nursing, you will start to learn from the A to Z. No, don't do that. You don't have time. Study the important concept. If you don't have that options or facility to get the important contents or something, means for that we are, or like us, lot of coaching centers are there. For that we are giving you, so we will, like a capsule, we will make the important topics contents. If I'm talking about our coaching, there will be video classes regarding important topics. We will not give you, lot of classes. That is what is why we are different from others, because we know that you people are working somewhere. You have only 1 hour or 2 hour, maximum 3 to 4 hours per day. You will not be able to study every day. So if I give you, 100, sorry, like one class on a topic, if I give you 3 or 4 hour lengthy video class, I know that you will not be able to study that thing. So that's why we are giving you class. We are giving you class in a short, short condensed manner. Okay, so we will give you the basic class in a short condensed manner. It doesn't mean that very less few points, nothing. It contains all the points which you need, important points which you need. It's easy to read, easy to study. The study material also we made it in a condensed manner, short but powerful and simple, and you can study that thing. So because if you have time, you can take your book, you can make your own notes, but we know that you don't have that time. That's why we are making that. So study that thing. Then there will be exams for you to practice. We will tell you how to practice that exams. Those students who are already in the coaching, please follow this one. Okay, practice, practice, practice. Then after that, and along with that, watch this type of discussion questions, so that you will get more points, more tips and techniques. Like that, easily you can study. So those people who would like to join our coaching, a free live class means, I have commented in the WhatsApp, sorry, in the YouTube chat, I commented the link for joining the group, also my WhatsApp number. And those people who wants to join our coaching, they can also WhatsApp me. My WhatsApp number is 73561828880. You can also visit www.neuronnursingacademy.com. Okay, soon we will launch our app also. So in app also you can study. And those students who are doing our refund plan coaching, see, remember, for you, video classes will be opened one by one. When you finish one class, the other second class will be opened automatically, one by one. Without finishing one class, we cannot open the second class, to ensure that all the students are attending all the video classes. Okay, so today is August 1. At least start studying from today itself, and you have enough time in front of you. Do it properly. Okay, next class I will inform you through WhatsApp the timing. So that time you can join with us. And if your friends or someone is interested for this free live class, you can share it with them. And you can contact me on my WhatsApp, whatever your doubts or problems you feel or face during preparation. You can WhatsApp me, and I will try to help you as much as can. Thank you very much.